We're at iMedical Equipment and Service. We're looking at the Sentida 6 high-low hospital bed. And the Sentida 6 hospital bed has multiple uses. Primarily, this is going to be home care, long-term care, senior care, and ideal for handicapped and or also pediatric patients. But as a high-low bed, it basically sits just 12 inches off the ground. That's the position I've got it in now. And this bed will go up to just past waist high. So for caregivers, nurses, and people taking care of loved ones, they never have to bend over to take care of the patient. The bed has a lot of features. First of all, it's made by a company called Wissner Bosserhoff. It's a German brand, which is part of the Linet companies. I've got some other Linet beds in here, but Linet is basically a group of hospital bed manufacturers. And these engineers and people who put this bed together have done a phenomenal job. This bed is rock solid. It is going to last a very long time. It's very well thought out, and it's very, very quality, durable engineering products and everything else. Now, first off, they call it a pendant. In our world, it's going to be referred to as a remote control, but that's the technical term in a hospital. Head up and down, foot up and down. There's two different sections of foot up and down right here. And then you have this section right here, if you can kind of see that, where you've got a, it's called a BiMedix surface. But what this is going to do is it's going to sit the person upright, but when it's in this position right here, it's reducing the amount of pressure on the person's hips and midsection, which is going to reduce the chances of getting a pressure sore, bed sore, pressure wound, skin ulcer. And so that is a very, very well thought out feature for people that are spending a lot of time in bed and at risk of getting bed sores and pressure wounds. You've got your bed up and down and high up and low down. And then at the very bottom here, you've got the Trendelenburg settings, which is head above the foot, foot above the head. Now, for the purpose of the video, of course, we're going to raise the bed up. And as you notice, you basically can't even hardly hear this thing move. The motors in this are called Actuators, and they are the most efficient motor, provide a lot of power. They don't use hardly any electricity, but they're very, very durable and long lasting, and they're extremely quiet. So we're going to go ahead and lift the bed up so you can get an idea of how high up it goes. Now, these beds are configured different ways. They can be configured with two rails. This is what we call a 3/4 rail, and this rail system is extremely easy to remove or just bring down. You've got a little section right here. You just click that little piece, and that comes right down. So it's easy to get in and out, but the thing that's nice also is when the rail goes up, as you can see here, you still have plenty of space where in the worst case scenario, somebody could still get up and get out of bed. But if they're at risk of falling out of bed or something like that, this 3/4 rail is going to keep them pretty well tight and keep them from rolling out. One thing that people do also with high-low beds, because that is for risk management for people falling out of beds, they drop them down. Like I said, it's just 12 inches off the ground. And when it's 12 inches off the ground, you can put another mattress next to the bed. So if somebody does roll out of bed, all they're really doing is rolling out onto another mattress, which is something that, you know, that we've seen other people in hospitals and places do in the past. This is the BiMedix surface right here. You can see with this extra space in this panel down here, it's giving the body more space to kind of spread out. It reduces the pressure on the hips and the lower part of the body. When the head section goes up, what's happening is that you're putting a lot of your body weight into a small section of the bed frame, and so these BiMedix surfaces are very good for reducing the amount of pressure that's going into those areas. And then I have the Trendelenburg feature. So I'm going to go ahead and put the bed into Trendelenburg, which is going to basically drop the head, or drop the foot down, keep the head up. But this is another way you can put a bed into a chair position. So if the person wanted to eat or have something to snack on or sit more upright in bed, by simply doing that, you can basically put this bed into a chair position. So high-low beds are basically called high-low beds because they go lower to the ground than the average hospital bed. Most hospital beds are going to be 15 to 17 inches. And like I said, this bed right here is going to go down to 12. And then it also does have an extender right here, where this section right here on the end with that yellow bungee cord, you can basically lift this up and extend the length of the bed. So if you have a taller patient and you want them to have a little bit more foot room, you can do that. We sell the Sentida 6 hospital bed, high-low bed. Basically, we get a lot of demos. We sell these almost in new condition, but we get these and we're able to provide a full warranty on them. Like I said, for home use, for long-term care, for hospital care, this is a commercial-grade hospital bed. This is not, some flimsy type of a bed frame. This thing is rock solid. In the worst case scenario, you need an air mattress. This is actually another Sentida 6 right here. This has been configured differently. This has been configured with 2 rails instead of the 1. And you can see with the way that this panel is set up, it's very easy to hang a pump off there if the person's going to need an air mattress system. And this right here is a very popular look that we also have. It's a very clean aesthetic look. So if you're looking for high-low hospital beds, give us a call at iMedical Equipment and Service. Ask about the Sentida 6. Fantastic hospital bed. We have these in all of our locations: San Diego, California, Cincinnati, Ohio, Richmond, Virginia, and Virginia Beach, Virginia. The Sentida 6 hospital bed, high-low bed, an excellent bed for long-term care, home care, and excellent patient care. Give us a call, iMedical Equipment and Service, San Diego, 858-263-4894, Cincinnati, Ohio, 513-341-1079, Richmond, Virginia Beach, 804-929-6886. iMedical Equipment and Service, your one-stop shop for hospital beds anywhere in the United States, anywhere in the world.